Well, welcome to the Botanical Medicine Study Course channel for your weekly botanical medicine update for July 21st, 2025. And this is my little botanical reaction to current events. Now, if you are looking for herb of the week, we will be continuing to do that once a month. It will always be the first Monday of the month. We'll look at a different herb. And if you want to get weekly herb of the month, you can go to my Patreon page and subscribe for $5 a month, and you will continue to get all sorts of material on that. You get botanical medicine updates, little blurbs on research and interesting things that are happening in the world of botanical medicine, as well as the herb of the week. So for this week, the botanical medicine update, I'm going to look a little bit towards healthcare policy and practice, particularly in light of the recent legislation that was enthusiastically voted in by a bare majority of the United States Congress and Senate. And basically, what I am responding to, like most people, I don't even know what to call what is going on these days in the United States, in the Congress in terms of legislation. But it seems that there are going to be some radical changes to how tax dollars are collected and spent. And I have an interesting take on that that regards botanical medicine. So we're going to have a little bit of a digression. Um, as you know, the United States has just withdrawn from the World Health Organization. This is an international organization that collects data, does all kinds of research, sharing of information on global healthcare issues. And they do a lot of good. But apparently, coming out of this is going to help make America greater. But I want to give a little background on one of the projects of the World Health Organization. And this goes back to 1995, which, gosh, is like 30 years ago. It's hard to believe. And it was on the fourth International Congress on Women. And this was held in Beijing, China. And for those of you who are familiar, the United Nations is truly a global organization, and it's made up of individuals. um, I'm not excusing some of the practices they do, which I don't necessarily agree with, but there's some wonderful things that the United Nations does. And these international conferences on all sorts of different topics, such as agriculture, children, the environment, family farms, you name it, they do a lot of really good things. And if you are associated with the United Nations, which you can, anybody can be associated with them. There are United Nations Association chapters all over the world. And I used to be associated with the chapter that was in Orange County, California. And whenever one of these big conferences comes about, what happens is the organizing people for these conferences put out a call for topics of interest and who's interested in what. So you can comment on stuff. You can say, maybe we need to, for instance, eat more oranges. And you can get these in what are called draft plans for action. And what was interesting about the fourth Beijing Conference on Women was that the draft plan for action called for the support and research and application of what they called traditional and indigenous forms of medicine. And if you are interested in botanical medicine, you know that every culture on Earth throughout history has a very well developed a paradigm of herbal medicine. And so this made it into the draft plan for action. There's 170 member countries. And what happens is there's basically a draft that is sent out to all member nations, and then the member nations, whoever is their representative, they get one vote, and they vote on whether or not to accept the document or to amend it, to take things out. And what was interesting was when this draft plan for action got to the governing bodies in Beijing, the part on supporting traditional and indigenous types of medicine was accepted by every member state. 170 nations had no problem with this. And there are lots of controversies that go on at these, conferences, but this was not one of those. And then the final plan, there was action to make women's lives better across the world, to support indigenous and traditional forms of medicine, and to encourage governments to increase access, to support it with policy, and also to encourage research and science in that area. So this was voted upon, it was accepted, and it became part of the draft plan for action. Now, whatever conference the UN has, and when they vote on these draft plan for actions, the representatives go back to their member nations and they basically make a report to them and they say, we voted for this. And then governments have the freedom to adopt or not adopt any or all of the plans in that. And so the Action for Women's Health included in 1995 a support for indigenous medicine. So I wanted to attend this conference because I was participating in those discussions and I wanted to see firsthand how this would happen. And it was an amazing, wonderful, and very inspiring um, action. Now, the Department of Alternative Medicine, which is now called the National Center for Complementary and Integrative Health, this started in the early 90s, and it was basically started in response to the AIDS pandemic because in the beginning, before there were really good drugs that were discovered because of tax dollars investing in pharmaceutical research, and a lot of that pharmaceutical research was based on traditional and indigenous medicine, particularly Asian mushrooms, for some of the wonderful drugs that we have now for HIV and AIDS. And so this started before the Women's Conference and the draft plan for action to include that in it. And there were all kinds of legislative victories that happened in the United States after 1995. Many insurance companies started covering natural medicine, things like chiropractic, naturopathic medicine, acupuncture, um, individual medical savings accounts where people could start buying supplements. And in some states, they even cover things like that. And there, medical schools started having courses that physicians and nurses could take in order to learn about this. So there was a lot of changes after the AIDS epidemic, but also around this international conference on women and the draft plan for action. Now, one of the big takeout home from this 1995 draft plan for action that included natural medicine was a division in the World Health Organization to look at, study, and support traditional and complementary medicine. And there's an incredible report that was done in 2019, which is available. You can download the PDF. It's widely available. I think you can order hard copies of this. I don't know how long it would take you to get those. But they also have had pretty regular conferences, like sub conferences, through the World Health Organization on traditional medicine. And they call them traditional medicine global summits. And they're always in these really lovely places like, Thailand and India. But you can also participate online. And some of the research that's coming out of this, and also the support and the honoring of these types of medicine is really, really, really important, and I think quite vital right now. So, one of the reasons for the slashing of budget expenditures in North America, specifically the United States, is mainly because of the incredible amounts of money that is being spent. And you can look up all kinds of statistics, but basically, whatever statistics you get, specifically from, you know, the early 1900s all the way up to present time, the arrows go up. It's always an upward trend on the graph. And what I always tell people, and it certainly is part of my professional things that have shaped me professionally, was I took a public health policy class as an undergrad in a summer school course. And it was really interesting back then. National healthcare expenditures for the United States were 16% of GDP. And that's a lot. And what was interesting at that course was said that before the introduction of insurance, private insurance, say like between 1900 to like 1930, healthcare expenditures in the United States were anywhere from 1 to 2%. And then after the introduction of private health insurance, and then after the Depression, there was a whole big public and political support to create governmental programs to better the lives of everyday people. So things like Medicare and Medicaid were introduced after that. And then we all know the history of all of that. And basically, ever since those things have been introduced, the percentage of GDP spent on healthcare in the United States has literally just gone up exponentially pretty much every year. Now, what's also interesting is what's happening now. And so I like to quote one of my, I guess you would say, if you're interested in philosophy, Plato is always part of that. And he's attributed with this quote, and he says, necessity is the mother of invention. And as the United States is facing incredible cuts to healthcare, particularly for working class and poor people, and also this will affect everybody because, hospitals get a lot of their money from the government. Hospitals are going to close and people aren't going to be able to get their medicines and blah, blah, blah. What are we going to do about this other than protest? I mean, I think there's a lot we can do about it. I want to go on record saying that I do not support these cuts. I think they're very short-sighted. They're not well thought out, but then again, you have to consider the source. But because necessity is the mother of invention, what are some things we can do? Now, these are the reasons why, some people think that just closing everything down, just shut it down and we'll all save money. And these are statistics that, are widely available. And it was 4.9 trillion was spent in 2023. And this was basically 17.6% of gross domestic product, GDP. Now, this is in 2023, where we were still dealing with the pandemic and recovering from the pandemic. But basically, we were spending, and I would personally like this money, please, but $14,570 per person was spent on healthcare in 2023. And out-of-pocket spending grew to 7.2%. You can read all of these things for yourself. But the thing that I find most interesting, when we say average costs, expenditures for those over 65 years old was $22,356 per person. Now, for children, was basically 4,217, and for adults is 9,154 per person. But if you round that out, it's basically 14,570. And if you round out, that's basically 15 grand per person was spent on healthcare. And I think most of us don't feel like we're getting what we're paying for. Now, let's compare these average healthcare costs for the average American, which is about between $14,000 and $15,000, with other costs per person in other G7 countries. Okay, this is elderly people, working class people, and children. So in Germany, which is an economic powerhouse, they spend $6,400 per person. Canada spends about $8,119 per person. France spends about $6,630 per person. And the United Kingdom spends $7,460 per person. So when you compare that to 14,000 or 15,000, most of this is almost half of what we spend. Okay. So why? What's the deal there? What is the big difference between the United States healthcare system and the German, British, French, and Canadian systems? And the big difference is the policy and practice of utilizing natural therapeutics such as homeopathy, medicinal herbalism, and natural healthcare providers. And all of these are used as gateways to the health system. Okay. So, if you have a sore throat, you don't need an MRI. You don't need all this other stuff. Maybe you just need to, I don't know, gargle with some eucalyptus, tea or whatever, homeopathic remedy, or look at your diet or whatever. But in order to enter the healthcare system in these countries that spend almost half of what the United States pays, you have to go through these other people. And most people go to the physician, they go to healthcare providers because they really want somebody to listen to them. Okay. And in the American healthcare system, the physicians are so stretched beyond capacity. You are lucky to get 10 minutes with a physician. And I used to get yelled at all the time when I practiced with physicians. Why are you taking so much time? You can, don't take so much time. And then when we would do case review, I would say something about a patient like, by the way, they're an alcoholic. And the physician would say, how did you know that? And I was like, well, I did a thorough history and asked questions. And it just takes longer than 10 minutes sometimes to get at the bottom of why somebody's sick. So it's not necessarily the physician's fault. Most physicians go into healthcare because they care and they want to help people, and they're smashed into this system that makes them see as many people as fast as possible And then obviously the best way to deal with all of that is to push pharmaceuticals. So, which can tend to be very expensive. So, this is a major reason why healthcare is much cheaper in those lands. So, that is a very long digression to say, since necessity is the mother of invention, and we are facing in the United States a serious, serious restriction of access to healthcare, ballooning pharmaceutical costs. You're going to take away all the regulations, especially, you know, pre-existing conditions, away the laws that are using, they're going to take all that away, which means a lot of people simply will not be able to afford healthcare. They will not be able to afford their medications. And if you're in a rural area where your only healthcare option was a hospital that got closed down, what are we going to do? Now, natural medicine obviously cannot address every issue. If I'm shot, I don't want to do a garlic tincture. I need surgery. I need the bullets to be removed. I would like pharmaceuticals to deaden the pain, anesthesia, and all that other stuff. I need highly technical medicine and the latest pharmaceuticals. But for the bulk of what ails humanity, nature actually has something to offer. And this may be part of the uh, invention that we need during this time of crisis. So, obviously, you need to, we tried lobbying our legislators. We tried, but they did it anyway. And well, what are we going to do about it? And in addition to registering to vote and voting people out that think it's okay to take away all health care from people, we can also say, well, what are we going to do when all of this is done and the people that caused this problem are out of office? What can we do? Well, let's actually build back better, and let's make sure that our healthcare system has an opportunity to include botanical medicine as part of our healthcare system that can be a gateway to deal with minor ailments and also chronic ailments that are not being addressed by pharmaceuticals. Let's use that at a fraction of the cost. So this is Stephanie Georgia saying thank you so much for spending your valuable time with me. If you're interested in supporting the channel, supporting my work, there's individual lessons that you can purchase on my Patreon page, or you can sign up to receive Herb of the Week. All kinds of ways that you can do this. And in these very frustrating and confusing times, let's look to nature for our healing and also to help calm us down. And I hope you all are going to be very well.